In a study carried out by Mahavir Cancer Sansthan in Patna, researchers found an impermeable substance in breast milk of women aged 17 to 35. The study was carried under the leadership of Dr. Arun Kumar and Professor Ashok Ghosh in collaboration with AIIMS New Delhi, led by Dr. Ashok Sharma from the Department of Biochemistry. The research analyzed breast milk from 40 mothers aged 17 to 35 in Bhojpur, Samastipur, Begusarai, Khagaria, Katihar and Nalanda. Uranium was detected in all samples with concentrations ranging from 0 to 5.25 GL per L. There is no permissible limit for uranium in breast milk. Nearly 70% of infants faced exposure levels associated with potential non-carcinogenic health risks. Meanwhile, as you can see, this report has come out and talks about the discovery of uranium content in breast milk as well as the assessment of associated health risks for mothers and infants in Bihar. Now, as you can see, this talks about how uranium is a naturally occurring radioactive element found widely in granite and other rocks. It also talks about how in India approximately 18 states and 151 districts are affected by uranium poisoning. So that's a staggering number. And there's also a prevalence of uranium concentration above the World Health Organization's permissible limit in some of the localized pockets of few states as well as union territories in the country. And this report also talks about the fact that elevated groundwater uranium levels have also been reported in numerous states of India such as Andhra Pradesh, Bihar, Chhattisgarh, Haryana, Jammu and Kashmir, Jharkhand, Himachal Pradesh, among others. Now, we can also see that this study talks about how it was. The study also talks about the fact that the health risk assessment was estimated with the uranium contaminated breast milk fed by infants. Now, the results of the study also show that all breast milk samples had significant amount of uranium concentrations in them and that there is no permissible limit or benchmark specified for breast milk uranium concentration. Now, we can also see that it talks about the breast milk contamination and that this table here shows the information about the statistical analysis of the studied districts and the decreasing order of exposure to uranium contamination in these districts. And you can see that it talks about the health assessment of the breast feeding infants and their average daily dose of uranium consumption through breast milk was estimated and represented in the form of an average daily dose as well. Now, the study reports that 100% lactating mothers have their breast milk highly contaminated with uranium and that presently there is no specified permissible limit or benchmark for uranium concentration in breast milk. The subjects were from 6 districts in Bihar, namely Begusarai, Bhojpur, Katihar, Khagaria, Nalanda and Samastipur. Meanwhile, I am joined by Dr. Ashok Sharma, who is an assistant professor of biochemistry of the biochemistry department at AIIMS in New Delhi. So, my first question to you is, the Mahavir Cancer Institute has now released a report noting that Alright, I am joined by Dr. Ashok Sharma, who is an additional professor at the biochemistry department at AIIMS, New Delhi. So, my question to you is, the Mahavir Cancer Institute has now released a report noting that uranium, which is a radioactive element, was found in breast milk samples in Bihar, hence making it cancerous. This is concerning and of course has serious health concerns on kids who might have consumed it. My question to you is, what really prompted you to do this research?
Yeah, see, this study is conducted by the Mahavir Cancer Sansthan under the leadership of Dr. Arun Kumar and Professor Ghosh and myself, AIIMS New Delhi, and we selected the different districts which you already mentioned, and we found the highest concentration of the uranium in the around 5.25 microgram per liter in the Khagyar districts and lowest in the Nalanda. But the permissible limit of the uranium as per WHO is the 30 microgram per liter. But as you rightly said, there are no limit of how much concentration in the breast milk should be need to further study. And as per this concentration, we need to further study how their impact on the infants and their health. But definitely it may affect on the IQ level, kidney development, neurological disorders. So that is the further question of research.
Possibly be the source of this uranium? Is there perhaps a way that the women whose breast milk samples were taken also had traces of uranium in their bodies, or could it be that the uranium was introduced while processing this milk?
See, the source is the groundwater. We check. Echo is going on somehow. Hello.
Yes, sir, you're
Yeah,
audible.
now
Please
it's
continue.
okay. So we check the groundwater. Yeah, we check the groundwater level of uranium, and 40 participants we enrolled in this study, uh, and we checked the concentrated uranium in the breast. But what is the source of uranium in groundwater, we do not know yet. It's more detail provided by Dr. Arun Kumar in that regard.
All right, sir. Is there a way that consumption of a radioactive material could also harm the people who live in close association with these children?
Yeah, see, this is the highest concentration get 5.25 microgram, and WHO limit is the 30 microgram per liter. So we need to check how much concentration is hazardous, but our study not found much in that, but we need to check further and long-term study what is the impact of this uranium on the infant development and future aspect.
Sir, could you perhaps also tell us if you could be carrying out this research in other states of India as well?
Yes, there are a lot of study also in Rajasthan, Maharashtra, and drinking water they got it, but we need to further extend and look out their impact on the human health.
All right, sir. Um, my one last question could possibly be that, in your opinion, what could be done so that this uranium is not perhaps present in the breast milk of other women?
No, what is your question? Please can you repeat?
Sir, in your opinion, what do you think could, so what are some of the preventive measures that could possibly be taken in order for this to not happen to women?
Yeah, we need to make a drinking water safe, because main source of the drinking water we need to maintain, and we study the cause where the source of the uranium in the groundwater. We need to prevent that one, so that it not should not come in the food chain, because now it's entering in the food chain. So every day we are consuming our food, crops, and milk. We need to identify the factors and do more research, and accordingly we take the preventive measures.
All right, sir. I'm also being joined by Mr. Arun Kumar, who is the senior scientist at Mahavir Cancer Sansthan and Research Center in Patna. Greetings, sir. My first question to you is, what could possibly be the source of this uranium? Is there a way that the women whose breast milk samples were taken also had traces of uranium in their bodies, or could it be that the uranium was introduced while processing this milk?
No, we have basically studied most of the districts of the state, and earlier we have reported the arsenic contamination in the breast milk and mercury as well. So very recently, when we studied and we went for the analysis of uranium in the breast milk, we in the 6 districts of the Bihar, we have found that the especially the Khagadia, Katihar, as well as the Nalanda, they were having the highest number. Although the highest degree of you can say contamination was found in Katihar with the highest 5.25 microgram per liter. As far as the source is concerned, literally we don't know that what is the source. But in the previous study which we carried out with the in association with the University of Manchester, we could find that uranium was present in the groundwater in 20 samples of Bihar out of 232. So this means that how this source is coming up, we still don't know. That is a big mystery for us. But it was very unfortunate to find out uranium presence in the breast milk of the women of Bihar.
All right, sir. Additionally, is there a way that consumption of radioactive material could also harm the people who live in close association with these children?
No, basically, it could be because since the mother is lactating the uranium, obviously, the uranium will be hampering the women health. But as far as the child is concerned, infant is concerned, in the long term, since it is absorbed in the bone, definitely it is going to cause lot of
Can you
health
just move now?
issues as well as the kidney impairment. And if you say that in immediate impact, it is not causing any immediate impact in the subjects, any of the subjects, like the infant and the mother. But in long run, definitely, if it is absorbed by the body system, it will cause lot of health issues in the women as well as the infants.
This does not happen.
No, presently, I mean, instantly it is not having any impact, but definitely if we look for 1 hour, 1 year or 2 year of the lifespan of the infant, definitely there could be a big challenge. Maybe in the long run, it could also cause the cancer-like disease in them.
Additionally, sir, the Mahavir Cancer Institute has now released this report noting that uranium, which is a radioactive material, was found in breast milk samples, hence making it cancerous. I just wanted to ask you, what really prompted you to do this research?
Basically, this was a big project which was sponsored by Indian Council of Medical Research, and this project was granted to us in 2021, and we almost completed the project in 2024 December. So during that time only, when we collected these samples, we sent these samples for the uranium analysis at Naipar Hajipur in Bihar, and they confirmed that yes, all the 40 samples we had sent over there had the presence of uranium. So this study was supported by Indian Council of Medical Research. So we are very much thankful to ICMR for this grant for this study.
Sir, I'm also being joined by Dr. Ashok Sharma, who's the additional professor of biochemistry department at AIIMS Delhi. So my question is, now the state government and the central government have already been taking measures to purify groundwater. However, on a personal level, what can be done so as to not to consume these elements?
So we need to make it like RO water and water purification system, so that we provide the more clean water and regular testing of the uranium and other heavy metals also, not only uraniums, because we also find arsenic and lead in the drinking water. So regular checkup of the water, so we provide the safe and clean drinking water, especially for the lactating mother or pregnant women, and that is the preventive measure we should take it.
I would also like to go across to Mr. Arun Kumar, who is a senior scientist. Sir, I would like to ask you the same question. The state government and the central government have already been taking measures to purify the groundwater. However, on a personal level, what can be done so as to not consume these elements?
Basically, we are seeing that our Chief Minister, Mr. Nitish Kumar, he is very much, I mean, working in especially the 7 nischayas of his, basically the government plans, in which he is providing to the all the households with the safe drinking water. That is called as Har Ghar Nal Ka Jal. So it is also being supported presently by the central government by Jal Shakti mission. So the people are getting, I mean, almost all the districts of the state are presently getting arsenic or the heavy metals free water. But the thing is that how this uranium is playing, I mean, how is it coming up? We don't know, because right now there is no such filters we are finding out which could, I mean, take out this uranium from the water. So we need to work more on this field, and definitely we will come up with a bigger solution in the coming future.
All right, sir, my last question would be, what would be your request to the state government?
We are definitely working with the state government, and we are always sharing all the information provided by our project work. And this, I mean, study definitely in hand with these state government will come up with a major solution for the exposed population.
All right, with that, I'd like to thank you, Dr. Ashok Sharma, as